Today I'm going to show you a simple 5-point acupressure routine that's fantastic for low back pain. Many of you who have been following my series on acupressure will probably already seen some of these wonderful points, and I've put 5 of them together to really impact the low back and have a greater effectiveness because of the routine. The first point we're going to do today is kidney 3. Kidney 3 is located just between the inner ankle and the Achilles tendon, right here in the depression. And I take my thumb. You can hold steady pressure on kidney 3. You'll often feel some warmth around where you're pressing and even going up the kidney meridian to the low back. This point is called the kidney source point, which means it does send energy, nourishment, and warmth, tonification we call it, back to the kidney. So it's great to kind of boost those tired adrenals, the low back that feels tired and achy. Here you can do a little bit of round rubbing or just stationary holding, whatever feels best. 45 seconds to a minute on both sides. So kidney 3 is point number 1. The second point you want to do, bladder 40, right in the back of the knee, right dead center. What I normally do is I take the pads from both fingertips and I press right in there. This one I like to actually round rub. Bladder 40 is a command point for the back, so it has a wonderful effect on moving stagnation and blockage, relieving pain anywhere in the low back and spine particularly. The nice thing about all these points is you can do these standing, you can do them sitting as well. So bladder 40 would be the second point in the combo I would do. Third point, halfway between the back of the knee and the ankle and a little bit to the side is bladder 58. I actually like to do this point where it's bent on the edge of a couch or a chair. You'll find this tight ropey band right in this area, and the most tender spot is bladder 58. This point is called soaring upwards, indicating the effect it has on moving the energy all the way up the bladder meridian to the low back and the back in general to really alleviate those symptoms. A lot of us stand a lot during the day and we get tired, achy low backs from standing a lot. So by releasing the calves, you'll get a lot of relief in the low back. So bladder 58, again, both sides, 45 seconds to a minute on both sides. Then we want to use the backs of our hands. Go right up here to the small of your back and do some round rubbing. This is bladder 23. It's the back shoe point of the kidneys, which means that the effect or the effectiveness by rubbing here has a direct effect on the organ beneath, which is the kidneys and the adrenals. So this is a great way to warm up that area. It's called a local point, so it'll relieve the tension exactly where you're feeling it here in the low back. And do this 45 seconds to a minute. And our last point, gallbladder 34. Find the knee and the side of the knee. You'll find the head of the fibula bone. Just drop underneath the fibula and a little bit to the front. Gallbladder 34 is the influential point of the tendons. This point has an effect of moving energy all the way up the gallbladder meridian. So when those low back discomfort, low back pain starts to affect the piriformis, the sciatica, and the hips, sometimes it's all rolled together, the low back pain, hip pain, sciatica, then gallbladder 34 is a wonderful point to add into this routine as well. Again, stationary pressure. 30 seconds, 45 seconds to a minute. Again, all these points are both sides. And because it's the influential point of the tendons, it's going to really help relax tight muscles and tight tendons. So to do a quick recap here, point number 1, kidney 3, followed by bladder 40, bladder 58 in the calf, bladder 23, both sides simultaneously, and then gallbladder 34 on the side of the legs. Really comprehensive routine that helps move energy, stagnation in the meridian itself. It helps the kidney organ, the adrenals themselves, through the source point of kidney 3 and the shoe point effect of bladder 23. This should be done 2 or 3 times a day when you're really having an acute flare-up. The body responds best with some sustained nurturing care. So even if you have a tendency to low back pain, but you're not in an acute flare, if it's more chronic, maybe 2 or 3 times a week, or you wake up in the morning with that stiff, tired, arthritic type of back, then you might want to do it every day, once a day, just in the morning, or during an acute flare. Do it 2 or 3 times a day whenever you're feeling that tension. Maybe at work, you could just piecemeal a few points and sit there and round rub bladder 23. Maybe gallbladder 34 if your sciatica is flaring up from tension as well. So you can kind of shuffle the deck a little bit, so to speak. Thank you so much for watching. Please like and subscribe.